Hello to all of the audiences. In this next occasion, we are from SGD number B1. We would like to present our student project entitled Blood Glucose Monitoring During Vacation for Type 1 Diabetes. But before we are going through the presentation, I would like to present to you our SGD number B1 members as shown in the slides. Okay, for the next speakers, the time is yours.
Okay, so hello everyone, my name is Feruza Husniadipa with 3 last digit of student number 102. So I'm gonna explain about the background of this student project. So blood glucose monitoring is an act to measure blood glucose level to detect any undulation or abnormalities in response to daily activities, medications, diet, and pathological aspects such as diabetes mellitus. So diabetes mellitus was divided into two types, and the type 1 is a chronic autoimmune disorder that causes immutable insulin deficiency. Therefore, the patients have to get insulin replacement for a lifetime in line with frequent glucose monitoring. And in Indonesia, around 3.5 million people have traveled abroad, and 41.8 thousand was the diabetes type 1 prevalence. So it suggests that almost 1.2% traveler from Indonesia may have had diabetes type 1. And during vacation, the shift in diet, lifestyle, environment, and activities can alter the level of blood glucose. So the poor preparations for type 1 diabetes patients while having travel can put patients into a diabetic ketoacidosis and high healthcare costs, and this make blood glucose monitoring and maintaining in patient with diabetes type 1 traveler more challenging. So it is important to understand how blood glucose monitoring can be done to ensure safety during traveling. And I guess next. Okay, so here's the problem formulations for this student project. So what is the definitions, pathophysiology diagnosis, and complication of diabetes mellitus type 1? And you can see it here in the slide. And then the objectives, there are general objectives and specific objectives. The general was to understand the procedure of blood glucose monitoring during vacations, and specific was, you can see it on the slide. Okay, next. Okay, and then for the benefit, it is to broaden knowledge about diabetes mellitus type 1 in general and the procedure of blood glucose monitoring during vacation, specifically for patients with diabetes mellitus type 1. I guess that's all from me. Thank you.
Hello, my name is Indra Pramesti with the last 3 digits of the number 208. So now I'm going to present about the definition of diabetes mellitus type 1. So type 1 diabetes mellitus is the most common chronic autoimmune disease in young patients, especially in children and adolescents. T1DM characterized by the destruction of pancreatic endocrine beta cells that are responsible for insulin production in the pancreas islet of Langerhans. As a result, the body develops insulin deficiency and hyperglycemia, with the classic trio of symptoms: polydipsia, polyphagia, and polyuria. So that's all from me. Thank you.
My name is Arin Anas with the last number of student ID is 002. I will explain about the pathophysiology of type 1 diabetes mellitus. The destruction of insulin producing cells in the pancreas, called beta cells, by the adaptive immune system. This process is driven by the interaction between a person's genetic factor and their environment. The hormone synthesized by the pancreatic beta cells, known as insulin, regulates blood sugar levels by moving the sugar from the bloodstream into the cells for metabolism. Another hormone produced by pancreatic beta cells, called glucagon, also helps the body in the process of regulating blood sugar levels. In most cases, type 1 DM occur due to an autoimmune process against pancreatic beta cells. This causes the pancreas to stop producing insulin, resulting in glucose retention in the blood. The inflammatory rising in beta cells involves the pro-inflammatory cytokines interleukin 1, TNF alpha, and interferon gamma. which are induced by autoreactive T lymphocyte, the cytokines active apoptosis. Type 1 diabetes mellitus is characterized by gradual damage to beta cell function. In the first stage, beta cell autoantibodies persist, but blood sugar levels are still normal and there are no clinical symptoms. At this stage, there are beta cells that experience stress. In the second stage, the number of beta cell autoantibodies can cause problems with blood sugar levels, but still do not show clinical symptoms of diabetes. At this stage, beta cells experience stress and death. In the third stage, beta cell autoantibodies become more dominant and diabetes symptoms begin to appear, which include insulin resistance, hypoglycemia, or hyperglycemia, behavioral and psychological disorder, and diabetes complication. That's all for me. Thank you.
Hello everyone, my name is Asikirana with real life student number 087, and now I would like to explain about the diagnosis of type 1 diabetes mellitus. Type 1 diabetes mellitus is typically diagnosed in children and adolescents and is unrelated to lifestyle variables. The classical symptoms of diabetes in children are characterized by polyuria, polyphagia, polydipsia, nocturia, and weight loss, similar to those seen in adults. Other manifestations such as tingling sensation, lethargy, delayed wound healing, and blurred vision are frequently observed. Ketoacidosis may be developed by some children, manifested by a ketone smell on the breath, abdominal pain, small breath, dehydration, vomiting, altered mental status, and potentially coma if the diagnosis is postponed. Type 1 diabetes mellitus is confirmed through a combination of laboratory investigation and clinical history. The diagnosis of diabetes can be established if one of the following criteria is met. Classic symptoms of hyperglycemia, along with random plasma glucose value greater than or equal to 200 mg per deciliter, or fasting plasma glucose value greater than or equal to 126 mg per deciliter, or 2-hour glucose value greater than or equal to 200 mg per deciliter during oral glucose tolerance test, or glycosylated hemoglobin value greater than or equal to 6.5% with NGSP and DCCT standard. Measurable antibodies against specific beta cell proteins are found in over 90% of individuals with newly diagnosed type 1 diabetes mellitus. Examples of autoimmune markers include islet cell autoantibodies, zinc transporter 8 autoantibodies, tyrosine phosphatase like insulinoma antigen 2, insulin autoantibodies, and glutamic acid decarboxylase antibodies. Examination of these autoimmune markers also helps determine the stage of type 1 diabetes mellitus, with different stages indicating varying levels of dysglycemia and autoantibody presence. I think that's all from me. Thank you.
Hello, my name is Nyoman Gede Wiragunatri Paramarta and my last 3-digit number is 180, and I'm going to explain about the complication of type 1 diabetes mellitus. Chronic complication of type 1 diabetes mellitus or T1DM include microvascular issues like diabetic retinopathy, which can cause blindness, diabetic nephropathy leading to chronic or end-stage kidney disease, and diabetic neuropathy resulting in nerve damage that cause pain, tingling, and numbness and can affect the autonomic nervous system. Macrovascular complications include cardiovascular disease and peripheral arterial disease, increase the risk of heart disease, heart attack, stroke, and reduce blood flow to extremities, leading to ulcers, infections, and amputations. Type 1 diabetes mellitus sufferers are more prone to infections such as skin, urinary tract, and respiratory infections due to a weakened immune response and poor circulation. Food complications from nerve damage and poor circulation often result in severe infections and gangrene, requiring amputation. Skin conditions like bacterial and fungal infections and itching are common. The chronic nature of type 1 diabetes mellitus and continuous treatment needs can lead to psychological issues like depression, anxiety, complicating diabetes management further. So that's all from me. Thank you.
Hello, I'm Mario. The last 3 digits of my number is 123. I'll be talking about the definition and most recent guidelines of blood glucose or blood sugar monitoring. Basically, blood glucose monitoring is a procedure to identify variations of blood glucose. There are two types of blood glucose, fasting and postprandial or post-eating blood glucose. Fasting is the blood glucose level after 8 hours of the last meal, while post-eating or postprandial counts between 90 to 120 minutes after eating. The normal level of fasting blood glucose is 70 to 99 milligrams per deciliter. Meanwhile, in pre-diabetic patients, it is around 100 and 125, and lastly, in diabetic patients, it is above 125. On the other hand, normal postprandial blood glucose is below 140 milligrams per deciliter. In pre-diabetic patients, it is around 140 to 199, and in diabetic patients, is above or 200 and above. That is all from me. Thank you.
Hello, my name is Komal Sri Bunga Sedani with the last 3 digit of student number is 241. I will explain the method of blood glucose monitoring. Blood glucose monitoring is essential for identifying patterns in blood glucose levels influenced by factors such as diet, medication, exercise, and health condition like diabetes mellitus. This level can range from normal to high. Regular blood glucose monitoring is crucial, particularly for individuals with existing blood glucose disorder. Blood glucose monitoring can be conducted outside healthcare facilities or within healthcare facilities. For the first one is capillary blood glucose test. Blood samples are typically obtained through fingertip puncture from the patient's non-dominant hand, although they can also be collected from the earlobe, heel, forearm, and palm. The finger was sterilized using a sterilizer. After the sterilizer had evaporated, a sterile was used to prick the finger to obtain a drop of blood. The first drop of blood was disregarded, and the second drop was collected and placed on the edge of the test by touching the strip with a finger. When a sound was emitted from the glucometer, the measurement result appeared on the screen. The second one is venous or plasma blood sample. In this test, venous blood will be collected through vein puncture for subsequent analyzed in the laboratory, incorporating meticulous quality control measures. This method offers unchanged precision compared to capillary blood glucose testing. The third one is continuous glucose monitoring. Continuous glucose monitoring does not track blood sugar levels, but instead monitor interstitial glucose level. The method of glucose monitoring utilizes water-resistant disposable device placed on the back of the upper arm and abdomen. These sensors are worn by the patient for a period ranging from 3 to 14 days and are subsequently scanned with a reader to display the glucose level of the interstitial fluid. This method frequently results in potential infection, discomfort, and pain in patients, leading to non-compliance with blood glucose monitoring. Non-invasive blood glucose monitoring involves the detection of measuring glucose in humans without causing harm on their tissue. There are several methods for non-invasive blood glucose detection, which can be broadly classified into optical, microwave, and electrochemical methods.
Thank you. My name is Gede Pramaditya Wahyu Saputra, and the last 3 digits of my student numbers are 045. In this occasion, I would like to present the planning in blood glucose monitoring on vacation. So, maintaining blood glucose levels can be difficult to do due to changes in some factors like diets, physical activity levels, and environmental conditions such as temperature and altitude during travel. Travelers with type 1 diabetes also have the additional challenge to packing the insulin supplies and the adjustment of insulin dose that could lead to complications of type 1 diabetes if the insulin is not given properly to the patient. Hence, it is important to plan on how the travelers are going to monitor their blood glucose on vacation. First, we have to plan when and how to monitor. Blood glucose monitoring can be done before, during, and after vacation to prevent the complication of type 1 diabetes. Before going on a plane, pilots and patients with diabetes diabetes mellitus type 1 must check their blood glucose levels 30 minutes before the flight. If their blood glucose levels falls within the range of 90 to 270 milligram per deciliter, they are clear to take off. Every time the patient eats doing high-level activities such as surfing, in insulin treatment, or even in a long driving, their blood glucose should be checked regularly. Second, pack sufficient supplies. Before packing the supplies for blood glucose monitoring, the patient should first consider capillary blood glucose monitoring or continuous blood glucose monitoring based on the individual needs. This equipment can be packed in a carry-on bag and be carried more than needed and need to be tested before being packed to ensure that they work. 3. Medication and insulin. Tailoring insulin therapy to fit individual needs, lifestyle, and goals is essential for effectively managing type 1 diabetes. It involves regular monitoring, correct insulin administration, and continuous education, all of which are vital for optimizing diabetes control and sustaining long-term health. 4. Travel documentation. Letter from a healthcare provider should also be carried. The letter can consist of medical conditions that the patient has, the condition of the patient, and the need for diabetes supplies for medication. 5. Adjustment for time zone. Patients with type 1 diabetes that are going to another area that have a different time zone should consult the healthcare provider so that they can advise on adjusting insulin doses and monitoring schedules based on their needs. 6. Diet. The patient should research first the food options in the vacation destination and plan what they should consume there. And the last one is emergency plan. The patient should list and know where the nearest medical facilities are and plan in the case of emergency due to type 1 diabetes complication. That's all from me. Thank you.
Okay, thank you for the time. My name is Shuda, with three digits of my last student number is 069. In this next occasion, I would like to explain the challenge in blood glucose monitoring on vacation. People who have chronic conditions like diabetes may be especially susceptible to the mental and physical strains that come with traveling. So, what is the challenges related to blood glucose monitoring on vacation in type 1 diabetes mellitus patients? The first one is unfamiliar cuisine, climate, time zone shift, and living situations. The second one is modification in food, physical exertions, sleep patterns, environmental conditions, and psychological tension. The third one is fluctuations in physical activity and disruptions in meal patterns, such as skip or delayed meals and overeating. And the last one is infection and injuries, restricted availability of healthcare facilities, and the multitude of preparations involved in diabetic management. Okay, that's all from me. For the next speakers, the time is yours.
I'm Gustia Gongresaniama Putri with last digits of my serial number R143 will continue with techniques in blood glucose monitoring on vacations. So diabetic patients must manage their condition carefully while traveling to maintain health and prevent complications. They should carry double the amount of medical supplies they needed and monitor glucose level frequently. That includes traditional monitors like subcutaneous glucose sensors and glucometers may be less accurate, so using a CGM is advisable. Time zone changes require schedule adjustments for medication and monitoring, especially for insulin users that travel to east and west. High elevation can affect monitor accuracy, so cross-checking with multiple devices is recommended. Diabetic travelers should also be cautious with new foods and maintain a stable diet to avoid glucose fluctuations. Maybe that's all from me. Thank you.
Hello everyone, my name is Rafadi Adrafadri with my last digit of my serial number is 244. Okay, so the technique in blood glucose monitoring on vacation. Before the patient travel, they must consult the doctor to be sure they are fit to travel and make sure that the patient have packed their diabetes supplies like blood glucose monitor, drugs, etc. And then as they travel, make sure that the patient chose the healthy food options. And then the drugs and other diabetes supplies must be in a good condition, and patient need to stay on schedule with the treatment. Lastly, patient need to check their blood glucose often. Maybe that's all from me, continued by my partner.
Hi everyone, my name is Nadira with my last digit number 160 and I'll explain about the conclusion. So type 1 diabetes mellitus is a chronic autoimmune disease that is primarily affect children and adolescents. It is characterized by the degradation of insulin production by pancreatic B cells, leading to hyperglycemia and the presence of autoantibodies. Diagnosis is confirmed through laboratory investigations, and blood glucose monitoring is actually crucial for managing the condition and preventing further complications. The blood glucose monitoring could have some specific criteria, such as fasting plasma glucose or 2-hour glucose level, and travelers with type 1 diabetes mellitus should also take necessary precautions to ensure their health and well-being during vacations by considering packing supplies, insulin therapy, carrying necessary travel documentation, adjusting for time zone changes, and also planning their meals.
Okay, that's all the presentation of student project of SGD number B1. We would like to apologize if there are any mistakes in our video. Thank you for watching.